The broadcast is now starting. All attendees are in listen-only mode.
Hey, good afternoon, everybody. Welcome to our Exercises Medicine on Campus webinar series. This is the first of this academic year. My name is Dr. Renee Heil. I'm the current chair of the Exercises Medicine on Campus Committee, and I'm super excited to have this powerhouse panel here with me today to talk sort of about where EIM-OC has started, where it is right now, and where it's going in the future. And I think that's really important for everyone to know how engaged Exercises Medicine on Campus participants and committees are with the larger EIM and ACSM goals and staff. So I'm going to let our presenters, we have Dr. Bob Salas, who's going to talk, Dr. Carena, and we have Robyn Stuhr, who's going to talk. I want to take one moment to say, hopefully all of you guys saw the Mascot Challenge videos. They were amazing. We had a huge response this year. Congratulations to all of the schools who took the time to participate and submit videos. We were looking at the scoring, and it was neck and neck to the end. You know, those of us from Kentucky, right? It was neck and neck all the way up to the end because they were really high quality videos. So I want to turn it over to Shelly for just a minute for her to announce the winners in case you didn't see it before.
Yeah, so in case you missed it, we had 31 submissions, which almost doubles 2018 submissions. So awesome job to everybody who participated. From the panel, we had a ACSM judging panel. Shenandoah won first place, so awesome job. They won the fan favorite last year, so they won the panel this year, so awesome job. The University of Connecticut won second place, and then the University of South Carolina, Aiken, got third place. For the fan favorite, Lone Star College Sci-Fair came in strong with over 1.1 thousand likes on their video. Yeah. So they came out strong. They came to play. Republic Polytechnic got second place. They're an international EIM on campus school in Singapore. And then Grand Canyon University got third place. So awesome job to everybody who participated. The videos were super fun to watch.
Great. All right. Well, I'm going to turn it over to Dr. Bob Salas, not that he needs any introduction, but to talk about how Exercises Medicine and Exercises Medicine on Campus started.
Well, thanks, Renee. It's a pleasure to be here. It's so exciting how this initiative has grown, and my hat's off to you and Carena and all the staff for bringing this to where it is today. It's just amazing, all the interest. You know, the Exercises Medicine idea really started for me as a family physician, attending ACSM annual meetings and just hearing the depth and the breadth of the research regarding the health benefits of exercise and thinking to myself, if this were a medication, I would be incompetent, be malpractice if I didn't prescribe it to every patient, and certainly I ought to think of it as the first line medication. And so as we began the first year of the initiative, I was doing a number of presentations, and actually Carena Winters approached me, at the time was at Chatham University, to give a talk there. And you know, as we started talking about it, I said, you know, given a bunch of these talks, why don't we try to do something more than just a one-off talk and that's all it'll be? What could we do to maybe even change your campus to generate more interest in promoting physical activity on campus? And I think all of us, certainly as somebody with children, as a father of 3 kids, I was been pretty dismayed about my kids' physical education experience, not only in college, but starting in elementary school, middle school, high school, where it's just been so de-emphasized, literally just taken out of high school. And the same has happened in college. And I felt like, why, you know, the most important subject a kid can learn in college or university, in my mind, is a lifetime plan for fitness. And why isn't that happening, and how could we change that? And at the time, Carena's president was very supportive, and ACSM staff was very supportive, and leadership at the time got behind this. And that was our first Exercises Medicine on Campus event, was at Chatham University. And it was amazing how it resonated with the university leadership, with ACSM members, and that's when we began to just slowly try to get other universities behind this, develop some criteria, what would be optimal in a college and university. And Carena did a great job leading this from the beginning. And it's just very exciting for me to see where it's gone. And I just think that should be a goal for anybody who's a professor, who's a faculty, staff at a college or university, and certainly the students the most important subject, the most important thing you can learn in college, in my mind, is a lifetime plan for fitness. That is the single most important thing. And how do we get others to rally around that? So I'm excited to be part of this webinar, share some of these ideas, and see if we can keep this ball rolling. So thanks for having me.
Awesome. Robyn, do you want to, we will be taking questions at the end of all of this. So if you have questions, just type them in the chat bar on the side, and then we can go from there. Carena, I think you're going to go next. Sorry, Robyn. I think you're going to go next and talk a little bit about how the Exercises Medicine on Campus committee went from, or on campus program went from there to when you handed it off a year ago.
Right, yes. Thank you, Bob, and thank you, Renee. So that was this May of 2009, where Dr. Salas came to Chatham, and we had brought together local academicians. We had healthcare providers, healthcare systems, and a number of other key constituents to try to map out what would exercises medicine on campus look like. And looking at the fact that there are many different types of campuses, rural, urban, large, small, you name it. And so we came up with a concept that one size didn't fit all, and then began the programmatic processes with ACSM, and there was incredible support. And as we began this process from 2009 into 2010, our current ACSM president, Dr. Jim Pavarnik, really embraced it as well and actually became our first chair of EIM-OC. So it was really exciting because he had the year of the student. So it worked very well. That was sort of his theme, and it worked very well with EIM-OC. So very, very grateful to ACSM and Jim and Bob for allowing this thought and vision to become reality. So we established a process whereby institutions could register with us, and that actually came about because we were having institutions contact us, but we had a number of professionals within institutions contacting us, and it wasn't really a coordinated effort. So we began the formal registration process. We created the leadership team, and we started to get very excited about other people getting excited on campus and really wanting this initiative to move forward. And we knew that a physical activity initiative isn't anything new, but we really believed that this was instrumental in creating a united front, and as Bob so eloquently always mentions, connecting healthcare providers with health fitness professionals in this area where we have a lot of experts on a campus. And Bob also says this very well, and it completely resonates with me, and we discuss this quite often, in that it is essential. These are the pivotal years, we believe, where people either adopt or don't adopt these lifelong habits of being active. And so we thought that we could really do a lot of good bringing people together and formally creating this initiative. Then we wanted to start celebrating what people were doing, because we saw so many people doing such amazing things that we created the recognition program, and that was a lot of effort, and a lot of research went into trying to figure out how would we best celebrate institutions, because not every institution could implement the physical activity vital sign and subsequent referral process. So we created the 3 levels that we know now, and that was super exciting. And we really wanted to reward institutions that were making movement a priority on their campus. And so these first 10 years were a lot of programmatic issues where we had to develop a best system to engage and create networking for institutions, help celebrate what institutions are doing. And we started to realize, which Renee, you're going to talk about, that we were kind of missing a piece that we're really trying to see, and that was the impact. So very excited that we're moving forward into the next decade of EIM-OC, and very excited to see what's on the horizon, which Renee, you're going to tell us all about.
I am, but first I'm going to let Robyn talk a little bit about, I think one of the things that has been interesting to me as chair is the background things that we as members of ACSM don't understand or is going on, and how what we do dovetails into those types of activities. And so I want to turn it over to Robyn to let her, if you don't know Robyn, I'm going to allow her to introduce herself and then talk about sort of how we fit in, exercises medicine on campus fits into the larger visions.
Okay, I'm going to just hopefully share my screen. Can everybody see this? My colleagues? In any event, I've got 10 slides. I am the Vice President of Exercises Medicine on staff here at ACSM. And I came 2 years ago, and at that same time, we formed a governance board for Exercises Medicine comprised of leaders from the college. ACSM feels that this initiative is so important that the president-elect, the president, the past president, and Dr. Bob Salas, who's the founder of Exercises Medicine, and a few other members representing science, the clinical space, as well as the fitness professional space, all got together to really step back and take a look at what was exercises medicine, what were our fundamentals, where did we want to go to make the best impact. And one of the first things they did was take a look, create a vision statement, which you should be seeing here. And that vision statement is basically to synthesize the real focus of exercises medicine, what we're about, what we want to be, our idea of what will be standard, and that is to make physical activity assessment and promotion a standard in clinical care, so that every time a patient is seen, that they get asked about their physical activity and it gets recommended or promoted in some way. And then the second part of that is connecting healthcare then with evidence-based physical activity resources for people everywhere and of all abilities. So this involves getting patients out into the community or referred to resources that will really work best for them. As part of, as a highlight of what makes exercises medicine different from other community-based physical activity initiatives is its focus on getting healthcare involved, because physical activity makes such a difference on health, prevention, maintenance of health. I mean, Dr. Salas can talk for probably 5 hours about the benefits, and we know it can make such an impact in both the cost of taking care of a patient as well as how they feel, how they function, how they move. And so the heart of exercises medicine is really getting it integrated into healthcare. Oh, whoops, I lost it. There we go. And so within the healthcare setting, we like to put exercises medicine into a paradigm called the SBIRT model: screening, brief intervention, and referral to treatment. And this was a model developed by the Institute of Medicine a few years ago to describe an approach to assessing and dealing with some lifestyle behaviors and challenges, for example, alcohol use or abuse. But we're adapting this structure to healthcare. And so the first part is routine physical activity assessment and screening. And we're recommending that every patient get asked 2 or 3 simple questions to help to determine whether they are or are not meeting the physical activity guidelines. And then that's something that's integrated either into the health screening that the patient fills out, or into into the electronic health record, so that it's automatically asked and calculated. The second part is brief advice or counseling provided by either the physician, a nurse practitioner, someone in the medical team to look at the results of the physical activity screening and comment with the patient. You know, Mr. Smith, it would be beneficial for your high blood pressure if we got you on a walking program. As simple as that, as short as that. Possibly giving a physical activity prescription that's more detailed based on their health and their fitness preferences. And then lastly, referring the patient to physical activity resources. And that could be programs, that could be exercise professionals, that could be places where they can be physically active, or self-directed resources. So that's how we want this to happen in healthcare. We're a ways from that happening, but we're putting together a plan to help move that along. Now, people have asked, well,
has access to all these fabulous documents that have been recently updated that are hugely supportive of launching or maintaining Exercises Medicine on Campus program. But you also get access to a logo for your school. You get access to more webinars. There's other things that are vital for being at least a registered school if you don't apply for recognition each year. I'm going to put one plug in for recognition. If you don't apply for recognition, there's no way to show the higher ups in your organization the impact of what you're doing. And I'm going to toss this back as sort of our first question for the roundtable is back to Dr. Salas. I'm not sure if everybody had the opportunity. At the national meeting, we all have competing time conflicts. But Dr. Salas pulled together this amazing roundtable of university heads and heads of state institutions. So Dr. Salas, do you want to talk a little bit about why that was important to you and a little bit about that presentation?
Yeah, I think it was important to me because there are universities out there that are doing some pretty amazing things that really have a commitment in the leadership, and I really wanted to highlight that, and hopefully people could take it back to their own universities and say, look what they're doing at these various schools. We had Tim White, who's the chancellor of the California State University System, which is the largest university system in the world. We had the dean of the University of South Carolina, Greenville Medical School. We had the president of Laverne University, a small campus by me. And we had a provost from Jacksonville. And so kind of various levels of the upper leadership of colleges and universities were represented. And each of them sort of spoke to what they believe in and what they are trying to accomplish in their role, their leadership roles. And I think that what to me would show is that approach your university president or dean or the provost on your campus with these ideas. I think these are softball ideas that everybody can get behind. And so often people just don't ask, or there's not really a plan laid out. And if you could sort of show them that other schools are doing this and that, you know, we're being left behind at our university if we don't do this, I think you could really get a lot of leverage, and particularly a young faculty member. I think this would be a really high profile way to do something positive for your campus.
Yeah, and I do want to say that some of the schools that we have seen be the most successful, if we look at it from a 10,000 foot perspective, with launching and getting institutional support for their Exercises Medicine on Campus program, is looking at what's the pain point for your school? Where does this dovetail into what the needs are for your institutions? Because they're all varied and they're all different, but they all have them. And all of these university presidents and senior administrators are looking for how to leverage programs to deal with those pain points. When I was at FGCU, the issue was we were really focused on retention, specifically at-risk students. Well, what we found was that our at-risk students were also our Exercises Medicine on Campus students. Demographics were exactly the same. And I got at my students by asking, did you or did you not meet the minimum physical activity recommendations from the American College of Sports Medicine? But the university was having a hard time putting their finger on those students, right? But those were the ones that they were looking to target. I know Georgia Southern, I think this is a great example. You've heard me say it 100 times. Transportation was an issue for them, and that was where they were able to get their initial funding. So I would challenge you to look at your unique institution and leverage that going forward, and bring it up to your senior administration, because as Bob said, they're interested. This is a softball idea to toss up to them. They're interested. You just have to help them understand how this is going to help them do their job. So I have some other questions of things that I want to talk about, but Shelby, do you have any questions from our group?
We got one question that just says that the new resources for the healthcare providers look awesome. So the question was that they couldn't find them on the website. So they're actually not under EIM on campus. They're under EIM or under healthcare providers, and then there's a resource page for healthcare providers. So on-campus programs are welcome to use that, and that's where they're located.
Right. Okay, so I am going to go back to those folks on the call. So what else? This is your opportunity to ask what else you would like to see from us. Okay, but I do want to go back to Robyn. I think it's important for us to understand how our committee interfaces with the larger objectives, and how is Exercises Medicine on Campus doing overall? Are we helping to meet those objectives? Are we exceeding them in places? Can you talk about some places where the program has done exceedingly well?
Well, when it comes to our metrics, so one of the things we're doing is say, what does success look like and how do we measure it, right? And so we're trying for each area to identify metrics that determine whether we're advancing the program. So for example, the metrics associated with EIM on campus have to do with registration, to your point, Renee, with recognition and how many schools are reaching whatever level of recognition. Engagement, again, so the website, we're looking how many people are coming and using EIM on campus resources specifically. And then we also did a survey at the end of the year, and you guys had the most amazing Net Promoter Score, which I know Carena and Renee and Shelby all know what this is. I think Bob does too, but it's something that you ask people about, you know, would you recommend this program to another campus or to another faculty member or student? And the numbers that we got in response to that question were incredibly high, which show that people find value in this program. So those are the ways that we're measuring EIM on campus now. Now, if you can get to how many students are we reaching, you know, how many students are now using the rec center that weren't before, or how many providers are, you know, integrating physical activity into their practice, or, you know, how many referrals are they making? Those kinds of numbers are helpful also. So, I mean, I like the direction in which you all are going to try to take a look at how impactful the programs are that you're running.
Thank you. Yeah, and that we were really excited about that Net Promoter Score, and I would love to say that I have that we, the committee, we probably had something to do with it, but I think a lot of it came from the engagement that we get from our registered schools and our member schools and recognized schools as well. So I just want to say, you guys probably don't get thanked, the individuals watching us don't get thanked enough for the work that you do, but when you talk about Exercises Medicine out in the community, it has an impact, right? Whether it be your community, your academic community, your social community, it does have an impact overall, and we're seeing the benefits of that impact, which is allowing us the justification to go after some of those other research dollars to quantify some of those other things that we need to do. I think Carena, or I think Robyn talked about a few things that we want to capture, right? How many students are we impacting? Carena, do you want to talk for a minute, because I think you do this really eloquently, about, we don't want to forget that we're exercise physiologists initially, right? We can get so excited about the programmatic piece, and we've touched so many students and we got so many of them to engage in Exercises Medicine, but you know, so you don't want to forget about the BMI and the actual physical activity levels of individuals. So you want to talk a little bit about those things that we're looking to get collected by member schools?
So you data beyond the paths?
Well, yes, beyond the paths.
Well, I think it depends upon the institution, and I'm not sure exactly what you're asking, but you're talking about just holistically what you see the student, because we know the dangers of not moving enough, but we also have other interesting data.
Can I jump in here, Renee? So our hope with Exercises Medicine that we're going to have a small meeting this winter to take a look at how we can promote a research agenda for EIM. And that to step back and say, what are the gaps in research? What do we need to have that will help us convince the key decision makers in various areas, whether it's government policy or healthcare CEOs and medical directors? What do we have to give them in order for them to implement physical activity within that system? So we're going to be taking a look and seeing where are the research gaps. And one of the things we're going to be looking at our campuses to do with professors is to engage in the kind of research that where we need it. And some of that research has to do with implementation science. So we all know that exercise is good for us, but what we don't know is what is the best intervention that we can use in a healthcare setting then to push out into the community setting that will really make a difference and get people active. What is that? What do those interventions look like? And you have to track that health outcomes data. You know, what interventions improve these health outcomes? What interventions contain costs or save costs? And that research is difficult to do because it has to happen over several years, at least the cost containment side. But the health outcome side is powerful too. So once we have developed, there'll be a paper that hopefully is developed as a result of this meeting where we're planning on having a session at ACSM's annual meeting in San Francisco to share the results of this meeting so that we can put out a call for research to all of our university campuses. So hopefully on November 2nd is the Board of Trustees meeting of ACSM, and they'll be voting on whether or not to support this particular initiative. And my hope is that yes, they will. And so stay tuned. That's where we can use help from campuses.
So Shelby, do we have any other questions that are coming in?
We do. We have a couple of questions about kinesiology departments at universities, and I think Carena might be a good person to speak about this. I know she's passionate about it, and maybe a couple other people on the panel, just talking about the importance of kinesiology students working with EIM on campus clients that are referred from the health clinics, and just the importance of the department interacting with the program.
Oh yes, I mean, I think this is pivotal for the success. I think our student champions are so important because they are the future of EIM-OC, and they're going to be going into the many fields, service fields that we have, whether they be exercise related, rehabilitative related, and I think it provides amazing experiential learning for our students, as well as it's under the supervision of faculty. So you have faculty and students working together to reduce health risk and improve health outcomes. So I think it's a wonderful opportunity. Oftentimes student organizations are amazing champions for fundraisers, for programming, for screenings, for wellness fairs. And the student, I mean, if you think about the excitement and the force that the students have. And I also think it's really important because when I could be the student's mother, sometimes I'm not connected exactly to how they might respond to an intervention, right? So we really look to our students to understand, would other students be interested in doing this? How could we get other students to really engage in this project? And when you see students on campus engaging in these activities, these initiatives, then it really encourages other students to do so as well.
I want to jump in here. Clinicians love educated exercise professionals, right? And so students who are learning about exercise science or being mentored by faculty are perfectly situated to offer their services to campus health, to say, look, we would like to help you do this and potentially do an internship in the campus rec center so that the clinician knows they've got an educated fitness professional that's going to work with their patient, and that the person is being supervised by a faculty member who can provide guidance. So exercise kinesiology department, exercise phys kinesiology department is so important in this whole picture.
I agree.
That's great.
So I have this brings up a question that we get all of the time, and I want to take advantage of the fact that we have Dr. Salas on the call with us. When we speak out in the community about exercise as medicine on campus, and there's a desire to engage physicians, right? Can you talk a little bit about how would you like, as a physician, like to be approached, right? You're supportive of the concept of exercise. We know that physicians who are physically active tend to be more supportive of the concept of exercise as medicine, but how would you recommend someone approach you?
Well, I think that, you know, certainly primary care physicians especially, we've got such limited time. I think what most we can expect from physicians in a clinical setting is maybe a sentence, you know, that they've taken an exercise vital sign, they realize this patient is sedentary, and just one sentence, either good job, you're meeting the physical activity guidelines, keep it up, or today I noticed your blood pressure is high, and you report you're doing zero exercise, zero amounts of physical activity. You know, why don't we just start, before I put you on a medication for that blood pressure or start you on insulin for your diabetes, why don't we start you walking? And, you know, and so just something that quick. I just don't think that it's feasible to get physicians to be able to allocate all kinds of time because there's so many competing priorities. But I do see, you know, we know that the kids who are active in college, 10 years later, 85% of them remain active. We know that kids who are sedentary in college, 10 years later, almost 70% of them remain sedentary. So I think this is our last shot at influencing health habits. And, you know, as you guys spoke, you know, I'm not in the university setting, but as you spoke about kinesiology departments, exercise science departments, the departments that get it, why would you guys not just make it mandatory for the students that are sort of under your control? That is, I think they ought to be fitness tested every year. I think you ought to feed it back to them. I would like to see their blood pressure measured, even their cholesterol, their hemoglobin A1C checked every year and fed back to them. We measure everything else in students academically. We're testing them all every month we're testing them. Why aren't we testing their fitness levels? And it seems like it would be easy enough for you guys in your departments to start this, that if you're a kinesiology major, you got to have a fitness test every year. And we're not going to be punitive about it, but we're at least going to feed it back to you. Don't you think that students have a right to know that they're becoming less fit and what they're doing, their BMI is going up, their hemoglobin A1C, their cholesterol is worsening? What do you guys think about that? Couldn't we sort of all agree that you start with your departments and then start talking trash to the other departments? We have the fittest department. Our students are the fittest in the university. And what if you started competitions on your campus? Kinesiology department is the fittest, and I'd be embarrassed if, as a kinesiology professor, if my students weren't the fittest. I would take that as a competition. Well, why couldn't we do something like that? I've sort of shifted your question, but I just think there's a lot of ways we could go with this, and I think it needs to be very prescriptive, that you have to exercise, we're going to measure your fitness, we're going to feed it back to you. Eventually, I'd like to see it on the transcript, because if I have two people academically that are about the same, in fact, I'd take the less academically inclined person if they were physically fit, because I know they're going to cost me less in healthcare costs. They're going to live longer, work for me longer. That's who I'd want to hire. Why are we promoting that?
So I know that when I was at FGCU, we tested our students. They had to have, we didn't keep that information. They kept it for themselves. And then they actually had trackers that were on them and are on them the entire time that they're there. And we counsel them, right? Because I think all students go through this period where, oh my God, I've got to study for tests, right? And they drop off on their activity. So I know that we did that. I'm assuming that a fair number did, but I can tell you what we're not doing. We're not systematically collecting that data in a way that we can correlate it with, we started that at FGCU, correlate it with academic performance, because there seems to be in the literature at least some suggestion that, and we know it anecdotally, but that students, believe it or not, if you study for an hour less and you get that exercise in versus not getting it in, you actually do a little bit better on those grades than that student who takes that extra hour to sort of cram. So I think I would also challenge, I think that's a great research study. Somebody's got to go out there and do it. I think that's a great research study, and I think it is something. I do think that we do hold, as a field, try to hold ourselves up to being that active representation, but I don't think we're quantifying it.
So Carena, when JU going to start fitness testing everybody? You have a supportive university president. Get it on their transcript.
We really do. I'm trying to get all students tested, but that's not quite easy to do. But we are actually considering re-implementing physical activity requirements for our major. So that's a start. And JU is one of many institutions that have removed physical activity requirements from the core. That's a
I
whole
don't
other
get. Why is that?
That's a good question. I'm not sure, but we are hopefully seeing a comeback. We are at some institutions such as Penn State, who re-implemented a couple of years ago, and potentially others.
So I think that's the movement we have to lead within exercise medicine on campus. It should be mandatory.
I'm not saying that that's not a bad thing. Let's put it on next year's agenda. I think we've got this agenda pretty packed, but let's put it on next year's agenda.
For me, Renee, it's always, Bob and I, it's probably one of the only things we maybe disagree about. And I don't disagree that physical activity classes would be a good thing. But for me, the important thing is to have a holistic wellness course that teaches the students the behavioral tools necessary to be active for life, to make decent nutritional choices, to think about getting enough sleep. That for me is absolutely paramount, because I think that whereas physical inactivity is obviously an independent risk factor and a very important one, putting it all together and it means it's going to allow them to continue, rather than what my children would say, you're forcing me to do this, to want to do this, and creating a culture that allows and encourages that to happen. Does that make sense?
Yeah, and I think
as a parent of college kids, I trust my kids to you at a college and university. I'm paying a lot of money to have them there. You give them this card that allows them to eat all they want, at the dining hall, mostly crappy food. You don't make them exercise. You stress them. You allow them to stay up all night partying, create all these bad habits. I don't even want to know half the stuff they're doing. So that's your responsibility. And the kids come in there less fit, heavier than when they came in. That's on colleges and universities. Don't you think they have a responsibility to do something about that? As professors, I know I know you believe this message, but I'm putting it on you guys. Why does that happen? Why do you allow that to happen?
Well, so I want to jump back in here and tie it back into one thing that I did want to mention that has sort of been said, right? I think the power of a lot of exercises medicine programs is its ability to coordinate across campus, right? To Carena's point, physical activity is vital, and we know it is, and it's what we're all passionate about. But the more we engage other groups on campus in our exercises medicine program, the more power we can have. If we engage in the counseling and psychological services departments, if we engage in the overall wellness component of it, it's just one more finger we can have in the pie that engages that university buy-in. And so I do want to sort of point out, because this is something that we're seeing as we're growing so rapidly, is that the key players that we asked be identified as part of the recognition, the registration process, is really important to show that you have some buy-in across campus for setting up this program. And we were very strategic. Carena, I know when she created the idea of the exercises medicine on campus committee for each school, was really key with thinking of who those players are, and it's something that keeps coming up as far as questions. So I really would challenge all of you to make sure that when you establish your campus team, that it's a strong team, that it has a cross-campus buy-in, and that you keep them regularly engaged in what you're doing from an on-campus perspective.
But the first thing, you got to start small. If you're a student on this webinar, you're a professor on this webinar, you should start in your class, your department, and then make that the example, and then try to spread, like you're saying, Renee, to the other components of the university that need buy-in. But start small. Anybody can make this happen in their own little world, and that's how it's going to happen as a grassroots.
I agree. I think that, and I consider it an enormous responsibility, and both a philosophical and ethical consideration, to make sure that we are providing those opportunities for the entire campus community, that we're making them understand that it's not just good to exercise, that it's extraordinarily bad if you don't exercise. And again, because they're adults, the students, you do all you can to educate and encourage and provide, and do your best with respect to that. But I agree with you. I think it's an enormous responsibility, and think one that we need to take seriously.
Take more seriously. Hold universities accountable. I don't think they're accountable.
Right. I mean, they could put better options in the cafeteria, but until we start removing soda machines and
Exactly. That's the kind of stuff we need to do, I think.
So I love the passion that's involved in this group, especially as we kick off another year, right? So we're into the semester, you know, things are starting to get bogged down depending upon your institution. You're around the midterm time period or you just got through them. So I challenge you to take some of this passion and bring it back to your own campus. Shelby, I think we maybe have time for 1 or 2 more questions. Do you have any?
Can't hear you, Shelby.
We can't hear you, Shelby.
Thank you. We have a couple more. One question here is from Jessica. She says, my institution has continued to grow our EIM-OC programming every year. However, she's struggling with engagement of campus members outside of the exercise science majors and the people who are already invested in their program. So she's just asking for any tips or ideas of how to get more people involved and to participate in the programming that they're offering.
Carena, do you want to take this one or you want me to do it?
Well, I can start if you'd like. I would say engage them in an additional way. Invite them, but also invite them to be part of the process. I found that that's been helpful, right? So oftentimes it is that we feel that we're preaching to the choir or that we are creating these activities and events and then we're the only ones coming. And so I think really engage other people, find student champions in other majors and create a healthy campus or EIM-OC campus committee that includes professionals from other disciplines outside of the disciplines that you have that are currently engaged or on the leadership team. I think that's important. If they feel like they have a stake in it, I think people are more apt to come and also to help promote. What do you say, Renee?
So I think I would say the same. I would sort of say the same thing. What we were fairly successful at FGCU at just approaching other people's events and saying, can we be a part of whatever you're doing already? Not even trying to engage them, just coming to them as, hey, can we support you? This, believe it or not, this suicide walk actually has something to do with physical activity and the benefits, and can we come and be a part of what you're doing? So we approached it from that perspective, and I think that engaging them and what they're doing is really important. But I think there's the other thing that I think we have to keep in mind is with Exercises Medicine, at least the referral program, we're trying to engage the people that are hardest for us to engage. Right? These are the people that we've been struggling for years to get involved in physical activity programs. So I think there's a piece of acknowledging that, right, and not expecting it to be the same participation that you might have in a kinesiology department. But then also the more you look at how to break down those barriers and get them involved through whatever that angle is. I know that there is a huge with the Park RX program. Park RX with the idea of getting out in nature and the benefit of nature. Well, what's the side effect of being in nature? And I'm not sure if everybody just saw that recent partnership with ACSM and Park RX. I have that relationship correct, right? Just saw that, right? Well, what happens when you get out in nature? Well, you're more physically active, right? It's a side effect, but they're not talking physical activity. They're really talking get out in nature and the benefits of being out in nature. And I think that there's ways to engage students regardless of where your geographic location in that manner too. So I think look for those opportunities that wouldn't necessarily be the ones that we would first choose.
I think taunting and trash talking work well, you know? Talk about how much fitter you are than all those other departments. Guys, you gotta boast about it. But to your point, Renee, you know, I'm amazed by the research showing how little physical activity you need to get the health benefits. You know, you just got to be out of that lowest 20% to get the bulk of the benefits. And I think that's a good message that I use with patients is telling them how little can you do to get those health benefits. And it's not a lot that you got to do.
Right.
So, and it's getting that person doing nothing to doing just a little bit that has the biggest bang for the buck. So getting those people on campus who aren't doing anything, that's a great target.
Awesome.
Agreed.
Is there another question, Shelby?
Yes, let's see. From Jordan, says, does EIM offer support in identifying the barriers on campus and with implementing physical activity programs? Maybe speaking about the committee a little bit, Renee?
So the committee is, no, I don't think we have a formal, the barriers on campus tend to be different by campus. If you mean this, like the student population and what the student demographics look like and their barriers to being physically active, that tends to vary by campus. Now, what we can do through the committee, as well as through Shelby, is to connect schools, similar schools together so that you can talk to somebody who's already has an exercises medicine on campus program set up and the barriers that they're experiencing so that you sort of don't have to recreate the wheel. And our committee members are highly engaged and more than willing to talk to schools who are at any part in the process of creating an exercises medicine on campus perspective. If you're talking about the administrative barriers to creating a program, I think that Dr. Salas said it better than anybody else, right? Keep it simple, right? If you start small and start to show that you have some impact, right, then it's easier to start to break down some of those barriers in other locations. I think that's what you were talking about. If I wasn't, shoot me or Shelby an email and we'll find the answer. So is there,
Great.
So I have one last thing if we don't have any other questions. Do we have any?
Yeah, go ahead, Renee.
All right.
We're good.
So, so here's the thing. So Dr. Salas, you're saying that you're challenging all of us. You're challenging all of us to be physically active, right? And so I'm going to go back to my committee and see if they wouldn't buy into this concept of, all right, we'll throw a little, throw a little bit in the game here and say, is our committee going to commit to documenting our physical activity for some period of time to show that we're not only in theory committed to this? And I'm going to challenge you to try to engage members at your level to do the same thing so that we can show them that there is some there is some power to that message, that it doesn't have to be a lot. It doesn't have to be a lot, but that we can act as leaders in the field, and that is an important thing.
Yeah, if we don't do this, nobody else is.
Yeah, very much. So I thank you all very much for taking the time out of your day to listen to this webinar, but more importantly, thank you to our panel for participating in the panel. I think it is really powerful for our registered and recognized schools to see how we've gotten here, where we're going, how it's being measured, and really understand that what you're doing has a much larger impact even than just your school. So as usual, if you have questions, you can email Shelby or myself. We'd be happy to answer them and hook you up with the right resources. And I wanted to point out that our next webinar, registration will be going out for that tomorrow. And our next webinar is December 4th, and we have a fabulous speaker from Jacksonville University coming in to talk about the power of getting involved in the power and the struggles, I guess, in getting involved in hosting a 5K. So even if you've never done this before, I think this is an important thing. This is dovetailing with one of the committee's initiatives this year, which is to provide an opportunity on World Physical Activity Day for all of our member schools to participate in a big group physical activity event. So stay tuned for more information on that as well. Thank you, guys.
Thank you.
Thank you.
Thank you.